I want to talk about the number to treat, and because in ONG there's a lot of things that really relates to number to treat. So what is number to treat? Basically, let's give some example. For example, Magpie study. So Magpie study says that 1 in 100 women who treated with magnesium sulfate, we can prevent one eclampsia in 100 women who was treated with magnesium sulfate. In ASPRI trials done by Dr. Nicolaides says that in 70 patients who treated with aspirin at less than 16 weeks, begin less than 16 weeks, we can prevent one preeclampsia. Let's take Mrcog study. Mrcog studies on the utrogestin. It says that one preterm labor can be prevented by treating 11 women. In other words, the lower the number of the number need to treat, the better the medication. Okay, so let's go to the table of confusions. But this time, we are not talking about the testing. The previous video is about clinical testing, but now we are talking about the exposure, be it exposure to treatment or be it exposure to some kind of disease like exposure to the smoking and also the disease. This is the different kind of table now. So let's say we take Magpie and ASPRI as the example. So this is the conditions with preeclampsia and this is conditions without preeclampsia. Now we take, for example, magnesium sulfate. Say magnesium sulfate is a good medication. Say magnesium sulfate is not that good medication as compared to aspirin. So exposure to magnesium and a patient which was not given magnesium sulfate. So let's make it eclampsia then. Okay, so let's say we want to say how much the number to treat in magnesium sulfate by looking at this table. So let's give, this is A. So when you have a magnesium sulfate, you give the exposure, magnesium sulfate to the patients, but patients still develop eclampsia. You have the A. If the patient was given magnesium sulfate and it's treated well, so there is no eclampsia, then you give B. If the patient does not given magnesium sulfate and develop eclampsia, you have C. And here is D. Okay, so let's put some value so that we can calculate first the relative risk and later the number need to treat. So what is relative risk? Relative risk is A divided by A plus B. So we are looking at this. We want to see the likeliness of a patient to develop preeclampsia if magnesium sulfate was given. Okay, so what is relative risk? A plus B divided by A plus B divided by C divided by C plus D. So let's calculate one by one. So if let's say I have a value here, for example, in a patient, we want to say that magnesium sulfate is not that good. So the patient who was given magnesium sulfate still developed eclampsia is 40, and the patient who given magnesium sulfate and does not develop eclampsia is 60. While we have here, for example, 50-50 lah. So A minus A plus B is equal to, so 40 divided by 100. So we have here 0.4. And C divided by C plus D is equal to 50 divided by 100. So you have 0.5. So what is the relative risk? Relative risk is equal to 0.4 divided by 0.5. This is equal to 0.4 divided by 0.5 is equal to 0.8. What does this mean? It means that the relative risk, okay, now we have relative risk reductions. So relative risk reduction says if the number is 0.8 for relative risk or ratio, there are 20%, because 100 minus by 80 is equal to 20. So there are 20% less likeliness for the patient to develop preeclampsia after given magnesium sulfate. Okay, so what is the number to treat? Number to treat is 1 divided by the absolute relative risk. So what is absolute relative risk? Is equal to the control minus the events in the control minus by the event in the exposure. In other words, for this case, 1 is divided by 0.5. This is control because you don't give magnesium sulfate, and this is exposure. You give magnesium sulfate. So 1 divided by 0.5 minus 0.4. So what you get here is 1 minus 0.1. So it's equal to 3. So the number to treat is, you have to treat 1 divided by 0.1 is equal to 10. So we have to treat 10 women to prevent 1 eclampsia using magnesium sulfate. Okay, let me give you another example so that it's become clear on what does this means. Let's draw the table of confusions. Let's take, for example, aspirin. Now we want to see if we have a less number here. If the relative risk is low, then the relative reduction risk is high. So the higher this number here is, the better. So this is disease. So for example, preeclampsia, without preeclampsia. Now let's just take the value equal to this value. So this is with aspirin, this is without aspirin. So let's just take, for example, we have here those who give aspirin. So we want to say that aspirin is better than magnesium sulfate, for example. So if let's say we have 20 patients with who given aspirin but still develop preeclampsia, and we have 80 patients who was given aspirin but does not develop preeclampsia. Now we have a condition where we have a patient who still develop eclampsia while not treated with aspirin, and those who does not treated with aspirin and does not have the preeclampsia conditions. So what is the relative risk? So let's calculate 20 A, B, C, D. So 20 divided by 100 is equal to 0.2, and 40 divided by 80 is equal to 0.5. Okay, so what is the relative risk? It's a risk when you have the A minus divided by A plus B divided by C, C plus D. So this means 0.2 divided by 0.5. Now 0.2 divided by 0.5 is equal to 0.4. So relative risk is 0.4. What is the triple R? What is the relative reduction ratio? It is 100 minus 40, so equal to 60. So there is 60% less likeliness for the patients to develop preeclampsia if the patient was given aspirin. So the bigger the number here, the smaller the number, the better. For example, here you have 0.8, so the RRR is 20%. So 20% only less likeliness for the patients to develop eclampsia after given magnesium sulfate. And here you have 0.4. So 60% less likeliness for you to develop preeclampsia. So what is the number to treat for these conditions? Example in aspirin is equal to 1 divided by the absolute relative risk. What is absolute relative risk? Is the event in the case divided by the event in the exposure. So for example, in this case, 1 divided by the exposure, the case. So 0.5 minus 0.2. So this is equal to 1 over 0.3. And this is equal to 3.33. So the number to treat is 1 in 3. So if you have a less number here, you're going to have a less number here, which indicates good outcome. So you only need to treat 3 patients to prevent 1 preeclampsia in aspirin group. Okay, so now the question that you have in your mind is, why do we have to mention about RR, relative risk? Because in many studies, you can find they report the relative risk, and they're going to plot the relative risk on the forest plot. But the conclusions that they're going to give you is the number need to treat. As you know, this is the lines of insignificance. This favors the placebo. This favors the interventions. So you're gonna have something like this. So that is why you have to know the relative risk. And when you talk about the forest, you have to know about the p-values, and also about the confidence intervals, and also the relative risk. I hope it helps at this point.